today I'm gonna do a head-to-toe examination. And the last time that you were here, you had some headaches. Is that correct?
Yeah.
Okay. Can you please verify your first and last name and your date of birth?
Yes, first name is IVB and last name ASMR.
Okay.
Date of birth is June 1st, 1992.
Any allergies that I should have on file?
No.
Okay. And are you taking any medications?
No, not really. Sometimes I take some multivitamins. That's it.
Sometimes?
Yeah.
Not every day?
Not very regular, no. I often forget.
Okay. And do you follow a certain diet?
I'm vegan.
Okay. So today we are gonna check your vitamin B's to make sure that you're not deficient in those. Also vitamin D. And any medical history, any hypertension in the family?
No.
Okay. Any problems with your vision or your heart?
No, nothing that I can think of. I did get my eye exam recently.
Okay. And do you have any back problems? Any joint aches?
No, nothing that I can think of.
Okay. Any injuries whatsoever, like an ankle injury or?
I did sprain my ankle recently.
Okay. Which one? Left
The
or
right one.
Right. And how recent was that?
I think it was probably like a month or a month and a half ago.
Okay. And you're not having any problems right now?
No, I went to an orthopedist and he said it was mild. Gave me a brace that I should use, and I used it for a few weeks, and that's it.
Okay. So I'm definitely going to go ahead and do a check and to see how the range of motion of that ankle is. Okay. Any skin disorders? Any redness anywhere or dryness?
No.
Okay. Okay, I'm just gonna go ahead and put some gloves on and I'll take your vital signs.
Okay.
Any chest pain, any palpitations?
No. You know, I have been noticing that sometimes when I stand up really fast, I get a little bit dizzy.
Okay, that can be a sign of dehydration.
Okay.
Or low blood pressure. Sometimes when you are dehydrated, actually can have both, so dehydration with low blood pressure.
Okay.
Drinking a cup of coffee, having just a snack, and drinking some water that could bring up your blood pressure and resolve the dehydration.
Okay.
Let's see how your blood pressure looks. Okay, so I'll put this on your arm. Okay, go ahead and relax. Your blood pressure is low, 100/60. Did you have breakfast this morning?
Yeah.
You did?
Mm.
And how many cups of water did you drink so far?
Probably not as many as I should.
Okay. Well, that could be an explanation.
Like 3 or so.
We will do a checkup to see if there are any other symptoms that we could associate with the dehydration. And if it's just dehydration, then we would just ask you to drink more water and increase solids as well.
Okay.
All right. This looks good. So oxygenation is 96% in room air. Heart rate is 83. Any flu-like symptoms in the last 48 hours?
No.
Were you in contact with anybody with fever?
No.
Okay. I'll put this under your tongue. Okay, very good. 99.1. Did you have any hot tea or any hot coffee before coming in?
No.
No? Okay. Just a little bit elevated, but nothing too concerning, I would say. Okay. So blood pressure 100/60. And are you feeling dizzy right now?
No. Okay. Just tired.
Okay. So tired. And how many hours did you sleep last night?
Maybe like between 6 and 7.
Okay, so I would say 6.5 hours of sleep, and you do feel tired. Pulse was 83. Oxygen 96% on room air. Respiratory rate was 16. Okay. So I'm going to ask you to put this gown on,
Okay.
and I will do a full body examination.
Okay.
All right, I'll be back.
The opening should be on the front.
In the back.
In the back.
Okay, Ivy. We're going to do a lymph node checkup. We're going to start with preauricular lymph nodes. Just gently pressing down. And postauricular lymph nodes. They're just inferior to your ears. Okay, supplemental lymph nodes. Let me know if you feel any kind of tenderness or pain as I'm gently pressing down.
Okay.
Checking trachea. see if it is midline. Just gently palpating. And I'm not feeling any deviations. Also, I did not see in your history any thyroid problems or anything in your family history, which is a good sign. And you are young, so your thyroid is working strong. I'm not feeling any lumps, no nodules. Okay, you're going to feel my fingers right under your eyes. Can you go ahead and clench your jaw? Okay, relax. Okay. I'm feeling a little bit of tension on your masseter muscles, left and right, nodular. Go ahead and open your mouth and close. And again, open and slowly close. Okay. Go ahead and open again. Wide as you can. And slowly close. Okay. No deviation of the lower jaw. I'm going to put one finger in each ear. So I'm trying to feel for any popping or any sounds that could come out of the jaw, which are right here. So we're looking for any TMJ disorders. Go ahead and open your mouth again and close. Good. So I did not feel anything abnormal. Moving down your neck, checking your lymphatic veins. Can you please shrug your shoulders a little bit? Okay. Just trying to see if there's anything swollen in the indentation here. Okay. I'm going to check your facial sensation now. Can you please tell me if you feel this on the left or right?
Left. Right. Right. Left. Left. Right. Right. Left. Middle.
Okay. Now I'll touch you with a sharp object, and this is what sharp is going to feel like.
Okay.
And then I'll touch you with a dull object, and this is what dull is going to feel like. Can you please tell me if you feel sharp or dull?
Okay. Sharp. Dull. Dull. No. Sharp. Dull. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. 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 No. Sharp. Sharp. Dull. 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 Sharp. Dull. Sharp. Dull. Sharp. Sharp. Sharp.
Okay. I'm going to check the hair distribution of your eyebrows and eyelashes. So I'm going to need you to stay very still while I'm doing that. Okay, very good. I am noticing one mole on the left eyebrow.
Yeah.
It does look circular, almost actually oval, but margins are well defined. It is a little bit raised. Normal color. And I'll check your eyelashes as well. Normal hair distribution. Okay. Normal skin color on the right eyebrow. Okay. Can you please tell me if you feel cold or warm sensation?
Okay. Cold. 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 Cold.
Okay, can you please tell me if this feels sharp?
Yes.
And what about now? Sharp?
I think so. Maybe the previous one was dull.
Does this feel dull?
No, sharp.
Oh, okay. What about now?
Sharp.
And now?
Sharp.
Okay. Does this feel cold or warm?
I think cold.
Okay. And is this cold or warm?
Cold.
Okay. Does this feel sharp or dull?
Dull. Dull. Sharp. Sharp.
Okay, go on and tell me if this feels dull or sharp.
Sharp. Sharp.
What about now? Is this dull or sharp?
I didn't feel anything.
Okay. And does this feel cold or warm?
Cold.
Cold or warm?
Cold.
Cold or warm?
Cold.
What about now?
Cold.
Okay, do you feel this warm or cold?
Cold.
Okay, does this feel sharp or dull?
Sharp.
Does this feel sharp or dull?
Sharp.
So I'd like to take a sample of your hair. I'm going to do a genetic testing. We're going to just collect a few samples of your scalp cells.
Okay.
try to send this to the lab. Okay, I'm just gonna go ahead and take a look at your abdomen. Is it okay if I put the gown a little bit higher? Okay. So we're just gonna go ahead and lift the gown up. Take a look at your abdomen. Have you been experiencing any abdominal pain? Okay. And so first I'll just visually examine. I'm not noticing any redness. I'll listen to your abdomen. Okay. I'm going to slowly just palpate your right side, check for any inflammation. Okay, abdomen feels soft. I'm not sensing any tenderness. Also, liver is normal size. I was able to hear bowel sounds in all 4 quadrants, which is very normal. Normal activity. Checking your ovary size on the left side. Normal. And right side. Also normal. I'll also gently palpate and check uterus size. Okay. It doesn't seem to be enlarged. I would also like to take some measurements. And I didn't notice some moles, so I want to make sure that they're not raised. feel sharp or dull?
Sharp. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. Sharp. 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 Dull. Sharp. 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 Dull. Dull. Sharp. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull.
Okay, very good. Everything looks normal. Okay, Ivy, I'm going to check your back spine alignment. Just checking to see if there's any abnormal curvature. The skin feels soft on both sides. Not feeling anything swollen. Normal spine curvatures. The skin feels well hydrated. I'm going to check for vitamin deficiency. To check your skin darker. Normal skin return. No signs of dehydration. Or vitamin deficiency. So that's very good. Can you please tell me if this feels warm or cold?
Cold. Cold.
And does this feel sharp?
Yeah.
What about now?
Yeah.
Does this feel sharp?
Yes.
this sharp or dull?
Dull. 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 Dull.
Okay. Going to tap in your spine to see if I'm noticing any neurological deficits. This is going to feel a little bit cold. Can you please take a deep breath in and breathe out? And again, take a deep breath in, breathe out. Again, breathe in and exhale. And again, breathe in and exhale. And again. One more time. Very good. I'm going to take some few measurements to check for any inflammation. Going to put this in your medical record. Okay, Ivy. Have you been noticing any pain on your feet or anything like that?
No.
Okay. I'll just slowly palpate, make sure that we are checking all the bones. So the metacarpals. Make sure that there is no fissure. Skin is intact. Doesn't seem to be any bone damage. And you did say that you had some issues with your right ankle, right?
Yes.
Okay. Very good mobility there. Okay. I'll check your Babinski reflex. Good. Good. Okay. Looking for any eczema.
also like to check your pedal pulses. Very good. 2 plus, strong and symmetric. No edema. Normal temperature. I'll collect a sample. Can you please tell me when you don't feel the vibration anymore?
I don't feel it.
Okay. What about now?
Yes. Stop. Yes. Stop. Yes. Stop.
Okay, very good. And can you please tell me if this feels sharp or dull?
Stop. Sharp. Sharp. Stop. Sharp. 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 Stop. Sharp. Sharp. Dull. Dull. Sharp. Sharp. Dull.
Okay, wonderful. So everything looks very good, checks out normally. I'm gonna have you sit on the table and I will do a vision exam and make sure that your smell and your taste are normal. Okay, Ivy, I'm just going to put a fresh pair of gloves and examine your ears. Okay, very good. Okay. Tympanic membrane is pearl gray. I'm not seeing any abnormal discharge. Any pain as I'm pulling up?
No.
Back?
No.
Down?
No.
And any pain here on the mastoid bone?
No.
Okay. Go on and check your other ear. Good. Tympanic membrane is also normal on this side. There's very little redness, but I would actually qualify it as normal. No abnormal discharge. And any pain as I'm pulling up, back, and down.
No.
Okay. Go ahead and keep your eyes closed and I'll whisper some words in your ears. Can you please repeat them back to me?
Okay.
Dorsal view.
Dorsal view.
Okay. Plantar linea.
Plantar.
And there was one more word.
Linear.
Yes. Okay. Okay. And now go ahead and look straight in my nose. I'll flash light in your eyes to check your pupil size. Good. any ocular pain as I'm flashing the light?
No.
Okay. So pupils are underreactive to light and accommodating. Can you go ahead and follow my finger with your eyes only? Don't move your head. Okay, and I'll check your salivary glands, your teeth, and uvula. Go ahead and give me a big ah. Any pain? No redness. Go ahead and stick your tongue out for me and move it up and down and side to side. Can you push with your tongue inside your cheek? And the other one. Okay. That looks very good. Can you please shrug your shoulders? Very good. And now go ahead and turn your head this way. Good. And now turn your head the other way. Okay. Can you please lift your eyebrows up? One more time. Very good. Can you go ahead and frown and puff your cheeks? Give them puff for me. Don't let me unpuff them. Okay, relax. Can you please close your eyes? I'm going to give you a smell to identify. Go ahead and cover one nostril and breathe in, breathe out. So no obstruction there. Do that one more time. Breathe in, breathe out. So can you first please describe the smell with one word and then identify it?
Citrusy and orange, maybe.
Okay. Go ahead and cover your other nostril now. Breathe in, breathe out to check patency. Very good. And now go ahead and give me another sniff.
It smells floral, like lavender.
Okay, excellent. And I'll give you one drop of this taste. So I need you to identify the taste for me, okay?
Cherry.
Okay. Excellent. One more.
Pineapple.
Perfect. Alright. I'm also going to check your reflexes. Can you please relax your jaw? A little bit more. Okay, very good. Relax your arm for me. Good. Okay. Okay, go ahead and fully relax your arm. Perfect. Good. Good. Okay, go ahead and relax your right leg for me. Okay. Okay. Let's try that one more time here. Okay. Very good. Okay. I'm going to definitely write everything up in your chart. Make sure that we're not missing any information. And everything looks very normal and healthy. I'll have you come back in about 12 months for another checkup. But before that, I would like to check your blood levels to make sure that everything is within normal limits, especially vitamin D. A lot of people tend to have low levels, and also vitamin B's.
Okay.
Okay. Since you're also complaining of some tiredness and some vitamin B deficiency could relate to that, as well as vitamin D.
I'm gonna go ahead and write that down for you. Make sure that we have a good order. And otherwise, do you have any questions for me or any other concerns?
No.
Hi, Vanessa. How are you?
I'm good. How are you?
I'm good. My name is Dr. Matt. I'm going to do your sensory exam. Can you please verify your first and last name?
Yeah, Vanessa Jones,
And your date of birth?
April 15th, 1997.
Okay, very good. I'm going to ask you some questions. I know that you're complaining of some sensory loss. Okay, can you please tell me where exactly that would be?
Yeah, a little bit like on my arms, like mostly on the left side, and then just like a little bit like in the like this area, like knee area.
Okay, so left upper arm and middle, and also right leg. And for how long have you been having this issue?
It kind of comes and goes, but I've had it for like maybe like a little over a month.
Okay. Any hypersensitivity anywhere on your body?
No.
Okay. Have you noticed any vision problems, any changes with smell, taste, or hearing? Okay. I'm still going to test those just to make sure that we're not missing anything. And I'm going to ask you to cover one eye. And with the other hand, can you please hold this chart? Actually, let's do this side. Perfect. And can you read this row?
428365.
Okay. And what number do you see here?
That's 8.
Okay. What number do you see here?
9.
Okay. Can you please tell me which circle is smaller, 8 or 9?
8.
Okay. Go ahead and switch eyes. And same thing. I'll have you extend this all the way. And now can you please tell me if you see this E on the right or left?
E's on the left.
Up or down?
Up.
Right or left?
Left.
And what letters do you see here?
X, X, O.
Okay, very good. And can you please close your eyes? What does this smell like?
It smells like lavender.
Okay, good. And I'm going to put one drop on your tongue. I'm just going to have you open your mouth. What does this taste like?
It tastes like a little salty.
Okay. Okay, can you please tell me on which side do you hear this sound? Go ahead and close your eyes.
Left. Right. Both.
Okay, and how many times do you hear this click?
3. 1.
Okay. Now I'm going to go ahead and test how your body perceives the painful stimulus. So I'm going to touch you with a sharp object. Can you please close your eyes and extend your palm? Perfect. This is what sharp is going to feel like. Okay. So I'm going to have you just put your arms around you like that and tell me if you feel this sharp.
Yeah. Sure. Yeah. Yeah. Yeah.
And do you feel this equally on both sides?
I feel the right side a little bit more.
Okay. Now I'm going to combine sharp with a dull sensation. This is what dull is going to feel like, and this is what sharp is going to feel like. Go ahead and tell me if you feel sharp or dull. I'm going to focus only on your arms.
Sharp. Dull.
Okay.
Sharp. Sharp. Dull. 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 Sharp. Dull. 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 Sharp. Sharp. Dull. Dull. Sharp. 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 Sharp.
Okay. Go ahead and tell me if you feel this equally on both sides.
The right side a little bit more. Equal. And right side. And both. Right side. Equal. Equal. Equal.
Okay. Go ahead and tell me if you feel this same on both sides.
Right side.
Let me do it first on both sides,
Oh.
and then tell me.
Left side a little bit more. Equal. Right side. Right side. Right side.
Okay, so there's a generalized sensory loss on the left side. Okay, I'm going to touch you with two objects now. One is going to feel warm and one is going to feel cold. Go ahead and tell me if you feel warm or cold.
Cold. Cold. A little more cold. Cold. Warm. Cold. Warm. Cold. 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 Warm. Both cold. Cold. Warm. Cold. Cold.
So there was some temperature problem there on the left side more. Okay, I'm going to check your position sense now. So I'm going to ask you to try to hold your arm this up, good. And I'm going to move your thumb up and down. So I need you to tell me if you feel it upward or downward.
Up. Down.
Okay, let's go ahead and check the other side too. Keep your arm up.
Up. Down. Up. Up.
Okay. Okay. Everything looks normal with the position sense. go ahead and check vibration. I'm going to use a 256 hertz tuning fork. I'm going to create a vibration. I'm going to ask you to tell me if you feel it equally on both sides.
A little bit more on the right.
Okay. On which side?
Left side.
On which side?
Right side.
Do you feel that equally on both sides?
A little bit on the right. I can feel it more.
Okay.
On the right.
Tell me when this vibration stops.
No. No.
Okay. Tell me when. Did it stop?
I think it did.
Okay, let's try them again. Do you feel that?
Mm-hmm.
Okay, tell me when it stops.
No.
Okay. Same thing. Tell me when you don't feel the vibration anymore.
I don't feel it.
You don't feel it? Okay. I'm gonna have you turn around and I will examine your back as well.
Okay.
I'm gonna go ahead and put your hair up. Okay, and I'm just going to first visually take a look, looking at spine and symmetry in the back. Normal color. I'm not seeing any deviations. Is it okay if I palpate your back?
Mm-hmm.
Okay. Just feeling for the spine, checking to see if there's any abnormal curvature. No signs of any spinal deformity. Okay, can you please tell me if you feel this equally on both sides?
Yeah, I can feel both sides.
Okay.
A little bit more on my right.
Okay.
Even. A little bit more on my right. More on my right. Even.
Okay. I'm going to tap on your spine to see if there is any abnormal reaction, movement. Okay, so there was a little bit of movement here in between the shoulder blades. Any pain?
Mm-mm.
Okay. Okay. One more here. Was that any pain?
No.
Okay, I'm going to touch you with two textures. One is going to feel sharp. This is what sharp is going to feel like. And the other one is going to be dull. Can you please tell me if you feel sharp or dull?
Oh, dull. 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 Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp. Dull. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. Dull.
Okay, go ahead and tell me if you feel warm or cold.
Warm. Cold. Cold. Warm. Warm. Cold. Cold. Warm. Cold. Cold. Warm on the right side, cold on the left.
Okay.
Warm. Cold. Warm.
Going to listen to your back. Okay, can you please take a deep breath in and breathe out? Again. Okay, Vanessa. The left side, there's a little bit of hypersensitivity and sometimes even sensory loss. So on this side, for example, there was a little bit of more sensory loss, and then as I went on the other side, there was some hypersensitivity. And I think we're gonna have to redo a repeat neurological exam, so another sensory exam in a week to see if there is any big change, and if there is, then we're gonna send you for some tests. Okay. Do you have any questions for me?
No, I think I'm good. Thank you.
All right. Since you're not having any pain, I think it's okay for you to go home and come back in a week.
Okay, thank you.
Thank you so much. See you soon.
I'm not really sure what I did. I did something probably with my shoulder, my right shoulder. It's just been hurting a lot these past, I would say maybe a week and a half. It sometimes goes up to my neck or like this area. I cannot really tell like a specific thing that happened. It just started hurting and then hasn't stopped.
Okay. So no accidents. And do you think you're overusing your right shoulder? Are you playing some sports or lifting too much, or did you do some exercises?
I don't think anything that would specifically overuse my right side more than the left. So I don't really know. I don't think so.
Okay, no problem. Let me take a look first and see what's going on, and hopefully we'll figure it out. And by today's session, we're going to really work those muscles and make sure that you have less pain than you came with.
Okay. So that's where the pain is.
Right here?
There and then
In the back.
Yeah.
Okay, I'm going to make some movements with this arm. Go ahead and relax. Let me know if it's too much.
Right there, I feel it.
Right here. Okay.
That's not as bad.
Okay, and I'm just going to twist the arm and bring it back. I'm taking a look at how your scapula presents, and I'm gonna go ahead and just push inside underneath your scapula just to see if I feel anything. Yeah, this side feels extremely tight right here. Okay. All right, I'm going to make some movements with your neck now. Let me know if you feel any kind of pain, okay? So relax. Okay, go ahead and look up.
It just feels a little tight.
Tight, yeah. Okay, we're gonna work right here on this side. It definitely needs some adjustment. Go ahead and look down, all the way down. Okay, and I'm just going to turn your head this way. Any pain here?
Not specifically. It just feels a little tight.
Okay, and let's see how your other side looks. Okay. Okay, I'm gonna go ahead and take a look at this arm. Any pain here?
No, not really.
Any pain here?
No.
Okay, what I'm gonna do is I'm going to start working on your scalp and just move down the shoulders, neck area,
and loosen up, the fibers. Okay, and I'm definitely going to focus on the right side, but I will try to adjust, your whole body. Have you ever had a chiropractic adjustment before?
Yeah, I did a while ago.
And it feels like it's been a while, definitely.
Yeah, it's been at least a couple of years.
Okay, so I'm gonna have you lay down.
Okay.
Face up. Okay, Ivy, so just relax. I'm going to adjust your neck first. I'm trying to loosen up the muscles around it, make sure that we are softening the tissue a little bit better before we crack your neck. Okay. So this side already feels a little bit better.
It feels better.
Okay. So I'm just going to perform a little bit of traction on your neck. Take a deep breath in and breathe out. Good. All right. Okay. Take another deep breath in and breathe out. Good. Perfect. Okay. Take another deep breath in and breathe out. Perfect. All right, how does that feel?
Feels really good.
Great. Okay, I'm going to do some more neck stretching. Excellent. And on the other side. Excellent. Okay, I'm going to put these a little bit on the side, and let's go ahead and just work these muscles. Now, this is gonna be extremely easy, okay? So go ahead and give yourself a hug. And this leg, you put it on top of your right leg, all right? And you turn towards me. Good, perfect. All right. Go ahead and take a deep breath in and breathe out. Okay, great. Let's go ahead and do the same thing on the other side. This leg like this, this one like this. Give yourself a hug. Go ahead and scoot yourself a little bit towards me. Great. Just like that. All right, go ahead and give yourself a hug. Take a deep breath in. Take a deep breath in and exhale. Good. All right, go ahead and relax. And now I'm gonna have you flip and be on your tummy. Okay, go ahead and take a deep breath in and breathe out. Good. Okay. Let's go ahead and do that again. Take a deep breath in and breathe out. Okay, go ahead and put your arm like this. Take a deep breath in, breathe out. Good. Well, take a deep breath in and breathe out. Good. Gonna have this arm, go ahead and twist it just like this so I can see a scapula. Okay, there you go, right here. This is where I initially felt that knot, and honestly I don't feel it anymore, so whatever we did up to now must have worked. Okay. Now this might feel a little bit cold.
go ahead and see how this side feels now.
It feels a lot better.
Definitely, definitely. Feels a lot better now. I'm going to work on your lower back as well. Since we adjusted the shoulders, we want to make sure that we're balancing, and we're working on your full body. I need to put some oil on these. So I'm going to be focusing on the right shoulder a little bit more.
one more adjustment that I would really like to do.
Okay.
And I usually leave this for the end to make sure that we loosened up all the muscles and we cracked the spine really well. So it's going to be a lot easier to adjust the shoulders at the end. Okay. Alright, so I'm going to have you take a deep breath in and breathe out. Perfect. Okay. So let's go ahead and fix this shoulder as well. Take a deep breath in and breathe out. Perfect.
That was amazing. I feel so relaxed right now.
Awesome. Well, I was able to really crack your back very well. So that is going to give you a realignment for the next few months at least.
Can I come back though? That was
Of course,
amazing.
Of course. So I recommend this treatment about every 2 weeks.
Okay.
There is no harm if we do it more often, but I think 2 weeks is a decent time.
Okay, I'll definitely be here in 2 weeks.
Excellent. So I'm going to give you a few core exercises. I'm going to print them out and I'm going to show them to you. And you're going to need to work a little bit on that. I think the shoulder problem is due to poor core muscles strength. So if we strengthen the core muscles, it's going to definitely help out with your posture and then the way you move yourself and the way you do things.
Yeah, okay. Yeah, sounds good.
Okay. Thank you so much, Ivy.
Thank you.
Hi, Jack.
Hi, Dr. Matt.
How are you doing today?
Good. I'm doing good.
Wonderful. So I see here that we have a 4 o'clock appointment.
Yet again.
Okay, wonderful. Well, thank you so much for keeping me busy. And you are in for a cranial nerve exam.
Correct.
Okay, great. And can you please tell me what exactly happened?
So, as I was on my way to work yesterday, we had a little bit of snow, and I slipped on a patch of ice. So, that's that.
Do you remember hitting your head at all?
I did bump my head a little on this
Okay,
side.
can you please tell me exactly where?
Left side.
Right here.
Yes.
Okay. Is it tender now?
It is tender.
Okay. So you said on the left side. Okay. Did you lose consciousness?
I did not.
Okay. Okay. And did you hit your back at all? Like your spine?
Not on my spine, but I did hit my left shoulder.
Okay. Left shoulder. Okay, wonderful. So what I'm going to do is I'm going to do a very thorough cranial nerve exam, and I'm also going to check your shoulder. So you said this shoulder, right?
Yes.
Okay. And do you still have full mobility in your shoulder?
Yes, but it is painful when I lift my hand over my heart, let's say.
Okay. And are you still able to continue your daily activities?
I am, but it's very tough for me.
Okay. Are you able to eat and to get dressed?
Yes.
Okay. Are you able to take a shower?
Yes.
Okay. Are you able to go back to work?
That's why I came to talk to you. I was wondering if I could have a few days off until I recover.
Okay. Yeah, so I can definitely take a look at you, and after that I'm going to write a leave of absence. Okay, so let's go ahead and begin. And right after the accident, have you experienced any headaches?
Yes.
Okay, blurry vision?
No,
Okay. Did you go to the emergency room?
I did not.
Okay. Any double vision? Good. And are you having any tingling sensations in your arms, your back, or your feet?
No.
Okay. Okay. Any facial sensation that is bothering you? Okay, any changes in your smell, in your hearing?
No.
Any changes in your taste? No. Okay, so that's very reassuring. What I'm going to do now is I'm going to examine your head and your scalp. I'm looking for any lumps or bumps and tenderness. So let me know if you feel any kind of pain.
Sounds good.
Okay. Go ahead, relax for me, please. So I'm not noticing any lumps. Okay. I'm checking your ears. I'm gonna go ahead and pull up, good, and down, no pain, and back, perfect. And I'm examining your neck as well. Also your lymph nodes. Good. Okay, and right underneath the jawline there are a few lymph nodes usually, but I'm not feeling anything abnormal. Okay, now I'm gonna go ahead and palpate your mastoid bone, which is right behind the ear. Okay, and I'm not feeling any lumps there. You're not complaining of any pain either, so that's very good. I'm gonna go ahead and slowly palpate your face. Let me know if you feel any kind of pain. Good. And underneath your eyes. I'm checking your sinuses. Good. I'm gonna go ahead and tap your face. Let me know if you feel any kind of pain. Good. Can you please clench your jaw? Good. Okay. I'm going to try to move your jaw side to side, and let me do that. Good. Good. Can you please shrug your shoulders? Okay, perfect. Okay, I'm going to go ahead and check your facial sensation now. So can I please have your palm? I'm just going to tell you that you feel this.
Yes.
This is sharp, okay? And then this is dull. And can you please tell me if you feel sharp or dull on your face? Close your eyes.
Sharp.
Good.
Sharp.
Good.
Dull.
Good.
Dull.
Good.
Dull.
Good.
Sharp.
Good.
Dull.
Perfect. And did you feel that equally on both sides?
Correct.
Very good. I'm gonna go ahead and check your sensation in your eyes. Can you please tell me where you feel this?
Left side.
Good. Where do you feel this?
Right side.
Good. Where do you feel this?
Left side.
Where do you feel this?
Left side.
Okay, perfect. Okay, I'm gonna go ahead and check your face further. So I'm noticing that you do have a scar. Is that scar very old?
Yes, very old.
Okay. And do you have full sensation on your face?
Yes.
Okay. Good. Okay, I'm not noticing any abnormalities. Okay. Okay. Good. Okay. So now I'm gonna go go ahead and check your sense of smell. And you're saying that you haven't noticed any abnormalities in your smell, right? Okay. I'm going to very gently palpate your nose. Okay. No structural deformities, so that's good. Okay. Can you please breathe in, breathe out? Good. Breathe in, breathe out. Very good. So both nares are patent. Now let's go ahead and see if you can identify some smells. Okay. So I'm going to obstruct one nair. Can you please identify this smell?
Yes, it's acetone.
Okay, very good. Okay, close your eyes. Can you please tell me what this smells like?
Coffee.
Perfect. Okay. And I'm sure you're going to enjoy this smell. Can you please tell me what this smells like?
Strawberries.
Wonderful. Okay, so everything is normal there. Okay. Next, I'm going to ask you to give me a big smile. Okay. Now frown. Okay, puff your cheeks. Keep them puffed. Okay, perfect. Just relax for me, please. Can you please open your eyes and lift your eyebrows up? Okay, very good. Now close your eyes again. Close them. Don't let me open your eyes. Okay, wonderful. So what I'm gonna do now is I'm going to check your gag reflex. Okay, I'm gonna ask you to open your mouth and say ah. Okay, wonderful. And go ahead, keep your mouth open. Can you please stick your tongue out? Very good. Move it side to side for me and up and down. Okay, very good. Wonderful. Okay. Okay, so now I'm going to check your taste. And I'm going to put one drop on your tongue. Can you please identify this taste? Okay. What does that taste like?
Feels like vanilla extract.
Perfect. Okay, and I do have one more. It's going to be the same. I'm going to put just one drop. And can you please tell me what this tastes like?
Vanilla.
Vanilla. Perfect. Okay, now I'm going to go ahead and check your eyes. I'm going to ask you to look right here, straight at me, please. So I'm checking your pupil reaction. Good. Wonderful. I'm going to do that a few times. Good. Okay, very good. Wonderful. Okay, can you please look up for me? Okay. Look up. Okay, very good. Okay. Can you please look at my light? Okay, just follow the light with your eyes only. Good. Good. Okay. Perfect. I'm gonna go ahead and check your peripheral vision. I'm just gonna go ahead and cover one eye. Please tell me when you see my fingers in your field of vision.
Now.
Good.
Now.
Good.
Now.
Okay, perfect. I'm gonna do the same thing on the other side. Tell me when you see my fingers.
Now.
Okay, good.
Now.
Good.
Now.
Perfect. Okay. Okay, can you please tell me how many fingers am I holding?
1.
Good. How many fingers am I holding?
2.
Okay, how many fingers am I holding?
5.
Perfect. How many fingers am I holding?
1.
Perfect. How many fingers am I holding?
5.
Perfect. Wonderful. What I'm going to do now is I'm going to ask you to identify some shapes. Can you please tell me what shape this is?
Boat.
Good. Can you please tell me what shape this is?
Heart.
Okay, good. Can you please tell me what shape this is?
Heart.
Perfect. What shape is this?
Star. Circle.
wonderful. I have here a Snellen chart. What I'm going to do is I'm going to have you cover one eye. Okay, very good. Can you please tell me what color this is?
Red.
Good. What color is this?
Green.
Perfect. And what number do you see right here?
8.
Perfect. What number do you see right here?
5.
Which circle is bigger, 5 or 8?
8.
Perfect. Can you please read the last row starting with this letter?
L, T, F, P, H.
Okay. Go ahead. Cover your other eye now. Wonderful.
L, T, F, P, H.
Good. And can you please tell me what number do you see here?
4.
Good. What number do you see here?
8.
Which circle is smaller, 4 or 8?
4.
Okay, perfect. Okay, so this is called a fundoscopy examination. I'm going to come a little bit closer to you and I'm going to examine your optic disc and your optic nerve. I'm going to ask you to pinch your nose and hold your breath for just a few seconds. Okay, good. Okay, look up for me, please. Okay, good. Wonderful. Let's go ahead and check your other eye now. Can you please look up for me? Good. Okay. Let's go ahead and do that one more time. I'm sorry. Okay. Okay, look down. Okay, look to the side. Okay, good. I do have another eye exam for you. I'm going to ask you to look straight forward at me and don't move your head. Now can you please look at my fingers right here? Perfect. And look at my fingers right here. Good. Can you please tell me which fingers are moving, right or left?
Left.
Okay. Keep on looking straight at me.
Left.
Okay.
Left.
Good.
Right.
Perfect.
Left.
Good.
Right.
Good.
Left.
Good.
Right. Right.
Good.
Left.
Good.
Left.
Good.
Both.
Good.
Right.
Good.
Left.
Good.
Both.
Okay, please tell me when you don't see my fingers in your field of vision.
Now.
Good.
Now.
Good.
Now.
Good.
Now.
Good. Wonderful. So it seems like your eyes are perfectly normal. Now I'm gonna go ahead and check your ears. And first I'm gonna inspect the auricle of the ear, which is the cartilaginous part. And I'm not noticing any lumps, no signs of infection. Good. No tenderness, no redness. Okay, good. And I'm gonna do the same thing on the other side. Okay. Perfect. First, I'm going to take a look. Okay, first I'm going to take a look inside your ear canal, make sure that there's no infection, no cerebrospinal fluid, which would be leaking from inside of your brain if it is injured. And I'm gonna go from there. After that, I'm gonna check your hearing. Okay, go ahead, relax, look that way. Okay. So the tympanic membrane is intact, normal vibrations, color is pearl gray. I'm not noticing any cerebrospinal fluid, no discharge. Everything looks very healthy. Perfect. Let's go ahead and check your other ear now. Okay. I'm seeing a little bit of
redness, but nothing to be worried of. And tympanic membrane is intact, pearl gray. Margins are very well defined. No cerebrospinal fluid leakage. Wonderful. Okay, keep your eyes closed for me. Go ahead, turn your head like this. Okay. Can you please tell me when you don't hear this sound anymore?
Now.
Good. And did you hear it equally on both sides?
Yes.
Okay, good. Same thing. Tell me when you don't hear the sound.
Now.
Good. Do you still hear it?
Yes.
Perfect. Okay, same thing. Tell me when you don't hear the sound.
Now.
Can you still hear it?
No.
Okay, let's try that one more time.
Now.
Can you still hear it?
Yes.
Okay, good. Tell me with which ear you hear this sound.
Left.
Good.
Right. Both.
Okay. I'm going to go ahead and whisper some words in your ears. Can you please repeat them back to me? 100.
100.
99.
99.
Wonderful. Now I'm going to go ahead and make a noise in your ears. Can you please tell me how many times you hear this sound?
3 times.
Good.
2 times. Once.
Can you please tell me when you don't hear the sound anymore?
Now. Now. Now.
Perfect. Okay, next I'm gonna ask you to just leave your jaw relaxed, okay? Okay, good. And I'm going to go ahead down your body and do a full neurological exam with a hammer. So go ahead, just relax your arm for me, please. Okay. Okay, I'm gonna do the same thing on the other side. This. Good. Okay, perfect. I'm going to move down your knees. Okay, perfect. Okay, wonderful. Okay, Jack, your cranial nerve exam looks perfectly normal. I'm not noticing any abnormalities there. I would really like to check your shoulder, if that's okay. So can you please take your shirt off for me so I can examine it better?
Sure.
Great. Okay, so I'm going to very gently palpate. Can you please relax? Good. Okay. Okay, so I'm noticing that your shoulder is a little bit more elevated than the right one, and also it seems to be a little bit bigger. So I think it is inflamed. Okay, it's not warm to touch, normal temperature. Can you please show me exactly where it hurts?
Over on this side.
Oh, okay, so it seems like you might have injured your scapula
that is connected to the shoulder joint. Okay. Is it okay if I come behind you and I examine you a little bit better?
Of course.
Okay. Okay, I'm going to do some movements with your arm. Can you please lift your arm this way? Okay. And in the back. Any pain there?
No.
Can you please put your arms like this for me in front of you? Lift them up. Okay, perfect. Okay. Lift this arm a little bit higher. Okay, good. Put it back down, same level. Now lift this one up. Okay, good. Okay, relax. Can you please tell me where you feel this?
Left shoulder.
Good.
Left back.
Good.
Left shoulder.
Good.
Right front shoulder.
Good.
Left shoulder back.
Good. Do you feel this?
Yes.
Okay. Do you feel this?
Yes.
Good. You feel this?
Yes.
Do you feel this?
Yes.
Okay. Do you feel this?
Yes.
Okay, perfect. So you have full sensation, which is very good. And I'm gonna go ahead and just slowly tap on the bony prominences. Okay. It hurts?
Yes.
Okay. Okay, so what I'm going to do with the tuning fork, I'm going to create a vibration sound that really helps to heal the joint a little bit faster, and it's going to bring an increased blood flow to the joint that is damaged. I'm going to try it in the most bony prominences, which is the scapula and the shoulder joint. Do you feel that?
Yes.
Good. Do you feel that?
Yes. Yes.
And I'm going to go ahead and put it one more time on your spine. I'm feeling a lot of tension in this area that you said it hurts the most.
It's getting a lot Better.
Okay. And now I'm gonna try to manipulate your shoulder. Relax, take a deep breath in. And I'm gonna try to gently press down, hold it. 1, 2, 3, and exhale. Okay, let's do that one more time. Take a deep breath in and hold it. 1, 2, 3, and exhale. Good. Okay, so I can already tell that you're starting to be a little bit more straight. Okay, let's go ahead and do that one more time. Take a deep breath in. Hold it. 1, 2, 3, 4. Good. Wonderful. Okay, go ahead and put your shirt back on. Okay, Jack, so I was able to do a cranial nerve exam. Everything looks very good and healthy. And also, I did some chiropractic movements with your shoulder joint. I think it's going to help a lot. I'm going to give you home this Biofreeze cream, and I'm going to have you apply it 2 times a day. It's definitely going to help with the inflammation, okay?
Sounds good.
And I'm going to go ahead and write your note for 2 days to be off of work. How does that sound?
Thank you very much.
You're welcome. Thank you so much for allowing me to take care of you today, and I'll see you back next time.
Sounds good.
Right. Hi, Katie.
Hi.
How are you?
I'm really good.
Wonderful. My name is Dr. Matt. I'm going to perform your first gynecology examination. Wonderful. Can you please verify your first and last name and your date of birth for me?
Sure. It's Katie ASMR. My birth date is March 20th, 1989.
Perfect. Okay, and do you identify as a female or transgender?
Female.
Wonderful. So what I'm going to do now is I will go over a series of questions. I want to make sure that I have a lot of information about you and that I know you really well. And after that, I will perform a wellness examination, which means I will make sure that I check both breasts for any lumps, any discoloration, any abnormal discharge from the nipples. And then I will check your pelvic area and make sure that there is nothing abnormal.
Okay.
Okay. All right. Are you taking any medications at the moment?
Yes, I'm taking Wellbutrin and trazodone at night to sleep.
And do you know how many milligrams of that?
150. Yep.
And how many milligrams of trazodone?
100.
Okay. Are you suffering from any conditions other than insomnia?
No.
Okay. Do you have any allergies to drugs, nuts, or latex?
No, not that I'm aware of.
Okay. Do you remember when it was your first ever period?
I was 14. Yeah.
And how many days are in between each period?
28, 30, about every month.
Okay. And how many days does it usually last?
My periods, they last like 3 days only, but they're really heavy. So it's like I'm getting it all over with at once.
Okay.
Yeah.
Are they very painful?
The periods aren't painful, but I do get cramps. And those can be very painful.
Are you taking any birth control?
No.
And have you ever received the Gardasil vaccine?
Yes, I have.
All 3 doses?
All 3, yeah.
And when was your last menstrual period?
It was about a month ago. I'm waiting on my one, my next one. So it's any minute now.
Okay, so around the 10th?
Yeah.
Okay. Do you remember the date of your last pap smear?
was like 5 years ago. So I would say, what would that be? I can't do math. 2017?
17?
Yeah.
Okay. And have you ever received any abnormal results?
No.
Okay. Are you currently sexually active?
Yeah, from time to time.
Have you ever had a mammogram?
No.
Have you ever had a bone density test to
No.
test for osteoporosis?
No.
Have you ever had a colonoscopy done?
No.
Any surgeries in your lifetime?
I had a bunionectomy, and this was about 10 years ago. Yeah.
Okay. Any hospitalizations for any reasons?
In my life? Well, yeah, when I was a kid, I had pneumonia, and it got really bad, and I was hospitalized for a couple days. Yeah.
Okay, so what I'm going to do now is I'll ask you some questions, but I want to know if you identify any of the disorders with any of your family members.
Okay.
So I'm looking at your mom, dad, any siblings, grandmother, maternal and paternal,
Okay.
and grandfather, same maternal and paternal. Any ovarian disorders?
No.
Any breast disorders?
My mother, she was 55, and she had a mastectomy, and now she's completely fine.
Okay. Any colon disorders?
No.
Diabetes?
No.
High blood pressure?
No.
And any heart disease?
No.
Do you have any brothers or sisters?
One sister.
Okay. Do you smoke?
No.
Do you use any recreational drugs?
No.
Do you exercise regularly?
Yeah, I do. I walk a lot. Yeah.
Okay. Perfect. So what I'm going to have you do is I'm going to have you write your name right over here.
Sure.
Your date of birth, your signature, and
Okay.
this will allow me to do the examination.
Yeah.
Perfect. Thank you.
There you go.
Okay. I never know where to open this. Okay, so I'm going to take your temperature. I'm looking for even slight changes in your temperature that would indicate ovulation. Also, if your period is just about to come, so that's going to give us a very good indication of where you are in your cycle. Hold it for me. Perfect. And I'll put this on your index finger. Relax. Good. 36.9. .99 percentile on room air. Heart rate is 78. Okay. So I'm also going to take your blood pressure. I want to make sure that it looks very good. Okay, so go ahead and cross your legs for me, please.
Okay.
I'm going to put this right here on your arm. And it's going to give you a squeeze. very good. Blood pressure is 118/70. It's very normal.
Oh, nice. Very good.
Okay. So what I'm gonna have you do now is I'll give you a gown. You're gonna go ahead and change, and then we're gonna perform the wellness examination. Okay?
Okay. Awesome.
Okay. So what I'm gonna do now is I'll check your heart.
Okay.
Again, this is not what we do on a regular basis when you would come and get your annual gynecology exam, but this is just a baseline that we want to have before we start to give you care.
Yeah.
Okay. Go ahead and relax. Very good. I can hear only S1 and S2, no S3, no S4. Okay, also no murmurs heard. Can you take a deep breath in and breathe out? And again, take a deep breath in and breathe out. Good. Perfect. And is it okay if I open up the gown?
Yeah, go ahead.
Okay. So I'm looking at your chest. It looks pretty symmetric. I'm not noticing any discoloration. Both breasts are equal in size. Skin is normal. Is it okay if I palpate? Okay, so I'm going to start with your right side. Okay. So what you could do is you could do the same thing once a month after your period ends, while you're in the shower or while you just woke up from a nap. But it's very important to do it after your period, because then you would not have any pain, and you would just slowly palpate, make sure that you don't feel any lumps, and if you do, we would have to have them checked. Okay?
Okay.
But everything looks very good.
I already kind of do that in the shower. I never like palpate. I just kind of like
Yeah,
feel
same.
around. Yeah.
That's what it means.
Okay.
Okay, I'm gonna go ahead and check for any abnormal nipple discharge. Okay, very good. Okay, I'm not feeling any lumps. Okay, so what I'm gonna do now is I will check your armpit area.
Okay.
Good.
Okay.
Perfect. So I'm not feeling anything swollen. What I'm going to have you do now is I'll have you lay down, and I'm going to do an abdominal and pelvic examination. Is that okay?
Yeah.
What I'm going to do first is I will visually inspect, make sure that I'm not noticing anything abnormal. I'm looking for any lumps, any discolorations, and let me know if it's uncomfortable in any way.
Thank you.
Okay, so I'm just gonna take a look. Okay, I'm not noticing any lumps. Everything is symmetric. And what I will do is I will gently palpate around, make sure that there is no swelling. Okay, very good. So what we're going to do now is we're going to do a pap smear. I'm going to use my speculum here, and I will open up the cervix. I'm looking at the cervix, uvula, make sure that everything is within normal. Okay, so I'm going to use my speculum here to open up the vaginal canal, and I'm visually inspecting for any polyps. Okay, very good. This is going to feel a little bit cold. Okay, that was very good. So what I'm going to do now is I will take just a small sample. Okay, on the count of 3, I'm going to have you take a deep breath in and then breathe out. 1, 2, 3, and breathe out. Okay, very good. Okay, we're almost done here. Okay, we're just going to do a few stitches on the cervix area. So what you're going to notice in the next 24 hours is a little bit of brownish discoloration. I just want you to know that it's perfectly normal. It's to be expected, and it doesn't mean that there is a complication with the procedure.
That's good to know.
Yes. So I believe we have all the samples that we need. What I'm going to do now is I'll just slowly palpate your pelvic area. Any pain there? Okay, so both ovaries are non-enlarged. I'm not noticing any masses, no pain, no tenderness upon palpation. Alright. So what I'm gonna have you do is sit up and we're gonna discuss the results.
Okay.
Everything looks very healthy. Do you have any questions for me?
Yeah, I had one thing in mind. Is pelvic pain normal? Like when you were pushing on my pelvic area, I did feel like a little bit of pain. I didn't know if it was because I'm about to have my period or if there's anything else to be worried about.
Well, if it happens just once in a blue moon, or if it's just a very slight pain, then that could be okay.
Yeah.
But if it's something that happens regularly, if it's kind of an intense pain, then that could indicate some other things, and I would definitely want to check that out. Okay? There is a little bit of cramping when a woman ovulates. So, but again, that cramping is not supposed to be anything intense. It's just be like, ooh, I feel this, but it's not supposed to be painful.
Yeah, I'm thinking that it was just, I'm just sensitive down there right now.
Okay. What we could do is, I would love to have you in for an ultrasound just to have a base of it.
Okay.
And this way we can definitely make sure that nothing is abnormal. But definitely pain is not a normal thing.
That's good.
It should not hurt when you have a gentle palpation. And it should not hurt if you're not on your period either.
Okay.
Yeah.
I'll keep checking the area too then after my period. But yeah, I would like to have an ultrasound.
Okay. Okay. Perfect. So I'm going to schedule you for an ultrasound and I will call you back with the results after we do it.
Okay.
Sounds good?
Sounds great.
Thank you, Katie.
Thank you.
I'll see you back soon.
All right.
Next person in line.
Hi.
Can I please have your passport and airplane ticket? Where are you traveling from?
Bolivia.
Okay. Were you there on business or
Just
leisure?
I guess leisure. I was seeing the ruins of Pumapunku. I'm a big Ancient Aliens fan, so I decided to go travel to see them, and it was great.
Okay. Do you have a job here in the United States?
Yes.
Okay. What do you do?
I'm a school nurse.
And how long have you been a school nurse?
Only about 5 years now. Yeah.
Okay.
So.
Are you traveling alone or with somebody?
My boyfriend.
And have you been working there in Bolivia?
No, we just went to see the ruins. Yeah.
Okay. Have you noticed anything illegal going on in the airport today?
No, not that I remember.
Okay. Okay, ma'am. So sorry, but I can't find your visa here. Let me see.
Oh.
Oh, there it is.
Okay.
Okay, good. Okay. I'm going to return this back to you. Okay. Go ahead and scan these. Very good. Again, that clear. Just gonna have to take a look at this again. Okay, very good. I'm returning this to you. Now, you've been selected for a TSA bat down. We're gonna have to search your whole person. Is that okay?
Yes.
Okay. I'm gonna have you remove everything that you have in your pockets, and also I will check your backpack.
Okay.
Do you consent?
Okay, yes. Yeah.
Okay, good.
Here. No
Okay.
change. This is my wallet. And a little piece of trash.
Okay, I can toss that for you.
Thank you.
Okay. Anything else? Have you emptied your pockets?
Yeah, there's nothing in here.
Okay, do you have your phone with you and keys?
Yeah. No, actually, my boyfriend has my phone, but I do have my keys.
Okay, go ahead and give me your backpack.
Yeah, they're right there.
Okay, I'm going to search this all the way at the end.
Okay.
So what I'm gonna do first is I'll check you for any metals. Go ahead and step one forward, one step forward. Good. No, I don't have a belt. Do you have a belt?
No, not today.
Okay. Okay, go ahead and turn for me, please. I'm going to start searching your hair.
Sure. I'll be careful, I just curled it.
Okay. I'm just doing my job now. Okay. Okay. Okay, go ahead and relax. This is definitely gonna be painless.
Okay.
Okay, ma'am, I'm gonna have you remove your jacket, please.
There you go.
Go ahead and take one step forward. Perfect. I'm going to start searching your upper side of your body. Is that okay?
Yeah.
Okay. Go ahead and relax. I'm going to have you put your arms like this for me. I apologize. Okay. I'm gonna have you turn around, please. One step backwards. Perfect. You wearing a bra?
Yes.
Okay, ma'am. I'm gonna go ahead and search your lower part of your body. Is that okay?
Yeah, go for it.
Okay, now I'm gonna have you spread out your legs. More. Okay, I'm going to put my hands up to groin. I'm going to put my hands up to groin. Okay, now I'm going to have you turn around for me, please.
Yep.
One step forward. That's good. A little bit more, maybe. That's good. Do you have anything in your pockets?
No, I don't. I do not.
Okay, good. Okay, I'm gonna have you open up your legs a little bit.
Okay.
A little bit more.
Okay.
Don't worry, I'm gonna let you know before I put my hands up the groin.
Oh, thank you. That's nice.
I'm going to put my hands up the groin.
Okay.
going to put my hands up the groin.
Okay.
Okay, very good. So what I'm going to have you do is remove your shoes.
Okay. Just slide them off here.
Yes, and your socks, please.
Okay. I have 2 pairs of socks on. So, I assume you mean both? Oh my gosh. I'm so sorry about my toes.
That's okay.
Holy crap, I forgot the paint.
Don't worry, the airport doesn't care about that.
Okay. Thanks.
Okay, ma'am, I'm going to have to check your soles of your feet for any residue. I'm going to have you turn around for me, please. You can hold onto the wall for support. Just lift 1 foot up at a time. Okay, now I'm going to do the drug test.
Okay. Toothbrush.
Very good. Okay, next foot. I'm going to go ahead and do the drug test.
Okay.
Okay. Okay, all good?
Okay.
I'll be right back with the results.
Okay.
Okay, ma'am, I'm gonna have to check your fingerprints and also for any drug residue. Is that okay?
Mm-hmm.
Okay. Ma'am, this is going to check underneath your fingernails, so very quickly I'm going to have to scrub. And don't worry, we're not testing dust, so
There's a lot of dust and sand in there.
that's okay.
Here around the ruins.
That's what I'm saying. This will not come positive to dust and sand, only to certain drugs that are illegal in our country. So if you haven't done anything illegal, there's nothing to be afraid of. This is painless and it takes only a few seconds.
Okay.
Have you done anything illegal?
No. I'm just trying to think if I have. I don't think I have.
Well, you either know or you don't.
Well, no, I haven't.
Okay. Okay, ma'am, and now final, I'm gonna have to scrape your tongue, okay?
My tongue?
This is going to be painless. So I'm going to have you stick your tongue out. Go ahead. I'm serious. Okay, I'll be right back with the results. Okay, we always do a temperature check before anybody leaves. 99.1. It's a little bit high, but I understand this was a very high stress situation for you. So let's go ahead and check your backpack, okay?
Okay.
Is this your backpack?
Yes, that's it.
And do you have any sharp objects in here? Any liquids?
I mean, I might. Nothing intentional. Like I have some makeup stuff.
Okay.
Yeah, I think it's all under the limit though.
Okay, we shall see. Unfortunately, I can't find anything that I can confiscate, so that is very reassuring for you.
Good, yeah.
I forgot to put your makeup bag. Well, you're a lucky girl today. I did not confiscate anything. Everything was very normal. So I'm gonna have you take this and you can go on your way, okay?
All right. Can I have my shoes and everything back?
Yeah.
All right.
All right, you can put your shoes on over there because we're very busy. Go ahead.
All right.
Next person in line, please. Good. Okay, come on. Hola, Ivy.
Hola, doctora.
¿Cómo estás?
Pues más o menos.
Okay.
Tuve un accidente la semana pasada y me caí bajando las escaleras. Me resbalé y me pegué un poco en la cabeza. Y desde entonces he tenido como migrañas y dolores de cabeza muy fuertes.
Ok. ¿Y cómo está el dolor?
A veces mejora un poco, pero creo que la mayor parte del tiempo yo diría que es como un 7.
¿No ha tomado algo para el dolor?
Solo ibuprofeno.
¿Y se siente mejor después?
No mucho.
Ok. ¿Me puede decir tu fecha de nacimiento, por favor?
Sí, es junio 22 de 1992.
Muy bien, gracias. ¿Y tienes algunas alergias?
No tengo alergia.
Muy bien. ¿Has tenido algunos problemas con la visión?
No he notado ningún cambio, la verdad.
¿Y has notado algún cambio a tu sentido de oído?
Sí, creo que a veces escucho como un pillido, un sonido así muy agudo. Creo que me ha pasado eso antes, pero ahora me ha pasado como más frecuentemente.
Más frecuentemente. Ok. ¿Un cambio con su olfato?
No creo.
Muy bien, pues, ¿qué voy a hacer ahorita? Voy a tomar sus signos vitales y después voy a chequear sus nervios craneales.
Ok.
Voy a poner mis guantes. Muy bien. Y lo primero voy a checar su temperatura.
Ok.
Lo voy a poner en la boca. Ok, lo puedes tomar. Gracias. Después, se ponen aquí. Muy bien, gracias. Es normal. Voy a tomar su presión. En está bien. Ok, relaja.
Ok.
Gracias. Ok, la oxigenación está normal también. Y el pulso. Ok, bajar las piernas, por favor. Gracias. Y relájate.
Ok, la presión está un poquito alta, pero no se preocupen, vamos a chequear todo. La presión está a 100 a 40 sobre 65. Y el pulso está a 77. Y la oxigenación está 99%. Muy bien. Ok, Amy. Ahora voy a examinar su cara y su sensación. Por favor, cierras los ojos.
Muy bien.
Ok. ¿Me puedes decir si sientes eso igual?
¿Puedo intentar otra vez?
Sí.
Creo que sí.
Ok. ¿Y esto?
Creo que se siente más en el lado izquierdo.
Ok. ¿Y esto?
Eso se siente más en el lado derecho.
Ok. Dígame si sientes un dolor cuando estoy haciendo esto.
No. No.
Muy bien. Ahora voy a checar su sensibilidad al frío. Por favor, cierra los ojos y dime si sientes esto.
Sí.
¿Y se siente caliente o frío?
Frío.
Caliente.
Frío. Frío. Frío.
Muy bien.
Frío. 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 Caliente. Frío. Caliente. Frío. Frío.
Ok, muy bien. Y ahora voy a hacer otra prueba. ¿Me puedes decir si se siente pulsante o suave? Por favor, cierra los ojos. Gracias.
Punzante. Suave. Punzante. Suave. Punzante. 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 Suave. Suave. Punzante. Punzante. Suave. Suave. Punzante. Suave. Punzante. Punzante. ¿Puedo repetir? Suave. Punzante. Suave. 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 Punzante. 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 Suave. Suave.
Ok, pues todo es muy normal. Esto es está bien. Lo que voy a hacer ahorita, voy a checar su cabeza.
Okay.
Me voy a mirar por simetría.
Okay.
Y dígame si siente algún dolor, por favor.
Okay.
La forma está normal. No siento ninguna inflamación. ¿Se duele aquí?
No.
Muy bien. Ok, relaja su... ¿Algún dolor?
Siento algo de tensión en el cuello.
Ok, ¿a dónde?
Como aquí en esa parte.
Ok, ahí vi. Ahorita puedes voltear su cara a la derecha, por favor. Voy a aplicar resistencia.
Okay.
Muy bien. Ok. Y a la otra. La izquierda. Muy bien. Ok. Y ahorita puedes cerrar sus ojos y quiero que les abras. Ok, muy bien. Ok, Ivy, ahorita puedes apretar mis dedos, por favor. Muy fuerte, 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 fuerte. Ok, muy bien. Y pones tus brazos así.
Okay.
Ok. Y pone resistencia, por favor, ok. Gracias.
Okay.
Muy bien. Ya abajo. Ok, muy bien. Ok, muy bien. Ok. Y ahora voy a checar su visión. Sí, por favor, me miren aquí.
Okay.
Muy bien. Ok. Y ahora miren aquí. Ok. Y ahorita miren aquí. Ok. Ok. Y ahorita por favor miren aquí. Y en el otro lado. Ok, bien. Y ahorita por favor dígame cuál dedo se están moviendo, la derecha o la izquierda.
Okay. Izquierda. Derecha. Ambos. Derecha. Izquierda. Izquierda. Derecha. Derecha. Izquierda. Izquierda.
Ok, muy bien. Ahorita por favor dígame cuando no ves mis dedos en su visión, campo.
Okay. Ahora.
Ok, muy bien.
Ahora.
Ok, muy bien.
Ahora.
Muy bien.
Ahora.
Ok, muy bien. ¿Qué voy a hacer ahora? Ahora voy a checar su nervio óptico. Por favor, que se mire allá a la pared. Y me voy a acercar a su ojo. Que se mire abajo, por favor. Que se mire arriba ahora. Muy bien. Ok, su nervio óptico está muy normal. No veo ninguna inflamación y la retina se ve muy bien también. Y ahora, por favor, cubre un ojo.
Okay.
Muy bien, gracias. Y con la otra mano ¿Me puede decir qué letras ven aquí?
Sí, L, T, F, P, H.
¿Y qué color es esto?
Verde,
¿Y esto?
rojo.
Ok. ¿Y qué letras están aquí?
S,
Y aquí.
D,
Y aquí.
O.
Muy bien. Ok. Vamos a hacer lo mismo con el otro lado.
Okay.
¿Y me puedes leer las letras?
Okay. L, T, F, P, H.
Ok. ¿Y qué color es esto?
Verde,
Y el otro.
rojo.
Ok. ¿Es el mismo rojo con los dos ojos?
Sí, se ve igual.
Ok, muy bien. Ok. Y ahorita voy a checar su olfato. ¿Algún olor que detecte que sepa que no existe?
No, no notaba ningún cambio.
Ok. Ok, se puede mirar allá. Ok, ninguna lesión. El color está muy normal. Y al otro lado. Lo mismo. Ok. ¿Puede respirar, por favor? Y con el otro nariz. Muy bien. Puedes cerrar sus ojos y me puedes decir a qué se siente.
Canela.
Muy bien. Tengo uno más. ¿A qué se siente?
Café.
Muy bien. Y ahora voy a checar su oído. Y por favor, ¿me puedes decir con qué oído escuchas este?
Ok. Izquierda,
Muy bien.
derecha. Ambas. Derecha, izquierda.
Ok, muy bien. Y ahora voy a decir algunas palabras en sus oídos. Y me puedes repetir, por favor. Examen de nervios craneales.
Examen de nervios craneales.
Muy bien. Rojo y verde.
Rojo y verde.
Muy bien. Vibración.
Vibración.
Tabaco.
Tabaco.
Visión borrosa.
Visión borrosa.
Ok, muy bien. Ok, muy bien. Y ahorita quiero checar su membrana timpánica.
Okay.
Por favor, que se miren allá, que se relajan. Membrana timpánica está normal. No estoy mirando alguna lesión. No hay síntomas de infección. Okay. Y al otro lado. Ok. Nada está rojo. Todo se ve muy normal, muy sano. Ok. Ahora voy a checar su audición
Okay.
con el diapasón. Y por favor, que se cierren los ojos y dígame cuál se siente más fuerte.
Okay.
Ok. Este es posición 1
Okay.
y este es el segundo.
Okay. El segundo.
Este es la primera posición.
Okay.
Esta es la segunda.
Segunda.
Segunda. Ok. Una vez más. Esta es la primera. Y esta es la segunda.
La primera, definitivamente.
Ok. Y esta es la primera. Esta es la segunda.
Primera.
Ok. Y ahora por favor, dígame cuando no oyes ese sonido.
Ok.
Ok. Este es el sonido. Dígame cuando no lo oyes.
Ahora.
Ok, muy bien. Y este es el sonido. Dígame cuando se apare.
Ahora.
Ok, muy bien. Ok. Y ahora lo voy a hacer lo mismo, pero aquí. Ok. ¿Lo sientes?
Ajá.
Ok, dígame cuando no lo sientes.
Ahora.
Ok. Y esto también. ¿Lo sientes?
Sí.
Dígame cuando no se siente.
Ahora.
Ok. Ok. Y una vez más. ¿Lo sientes?
Sí.
Dígame cuando no se siente.
Ahora.
Muy bien. Y esto también. ¿Lo sientes?
Sí.
Cuando no se siente, dígame.
Ahora.
Ok. Muy bien. Ok. El oído está normal. No lesiones. Muy bien. Y ahora voy a checar su boca. Ok. Puedes abrir la boca, por favor. Bien. Y puedes sacar la lengua. La puedes mover a la derecha y a la izquierda, arriba y abajo. Muy bien, gracias. Puedes sonreír, por favor. Muy bien, gracias. Y ahora voy a checar su gusto. Voy a poner una sustancia aquí y lo voy a poner a su lengua. Por favor, dígame a qué se.
¿Sabe a lavanda?
Ok, muy bien. Y tengo una más. Muy bien.
Limón.
Limón.
Un poco
Ok.
ácido.
Muy bien. Ok, ahora quiero checar su pie, por favor. Ok, relaja su pie, por favor. Muy bien. Ok. Ok. Los reflejos están muy normal. Ok. Y puedes empujar arriba y abajo. Ok, muy bien. Y abajo. Ok. Voy a checar su reflejo Babinski. Relaja su pie, por favor. Muy bien. Y al otro lado. Ok. Muy bien, gracias. Ok, Ivy. Afortunadamente, no tengo resultados negativos para ti, así que no sé qué está pasando porque el examen de nervios craneales fue intacto, todo salió muy bien, pero tú sí tienes dolor. Y te voy a mandar de hacer una resonancia magnética porque yo creo que está algo más pasando con usted. Ok. ¿Tienes algunas preguntas para mí?
No, creo que no. ¿Cuándo tengo que regresar?
Pues que regresen 3 días, por favor. Ok.
Ok.
Sí.
Muy bien.
Ok, muy bien. Gracias, Abby.
Gracias.
Lo voy a
doctora.
ver, sí.